Good afternoon. My name is Apfel, and I'm going to talk to you a little bit this afternoon about health literacy communications. And let me just say that I am so happy to be here at what I consider an immensely historic meeting where the great and the good of health literacy around the world have come together to redefine themselves as a global health literacy community. And what I really want to share with you over the next 15 minutes is 4 messages which I think will help us in terms of this goal. First, I want to talk generally about communicating health literacy, and I want to present a message, don't hem me in. Second, I want to revisit some issues related to measurement, and I'm going to talk about democratizing our measurement tools. Third, I want to talk about marketplaces and our ability to fight what I call health gliteracy as opposed to literacy, and some new opportunities and challenges in how we can be universal connectors. Now, I know that Andrew, in his paper, is that massive, wonderful paper, moans about the fact that there is no universal consensus of what is and is not a health literacy project and policy, that there's no global organization for health literacy, that there's no actual population of interest, or the actual population is undefined, and there's no universally equitable means to translate the concept of health literacy. What I would like to say is that all of those characteristics are really what allowed us to get here. The fact that we had no universal consensus, that there was no global organization, that there was actually, the population interest was undefined, that there was no universally equitable means to translate, allowed us all to start pursuing and engaging and trying to find some definitions that we could work with. The process has been what I consider more viral, admittedly a very slow-growing virus, than a controlled process. But it's been dynamic, and it's been growing, changing, expanding. We started out with issues related to compliance and health literacy, and now we're talking about advocacy and community engagement and talking about all areas of risk reduction. And now I'm going to try to push a new framing in regards to the fact that we consider ourselves global health citizens. And health literacy, we need to see ourselves as global. That we can't be seeing ourselves that what happens there affects here, and what happens there affects us. So we're looking at ourselves more as that global community. We need to understand that we're trying to deconstruct health systems so that they can get more intersectoral, that they can be more expansive. And here we have something with health literacy that's already established that. We have multiple champions, many sectors, disciplines, settings, and levels have engagement. So I think that we have a very refreshing lens that we can look at stuff with, and we don't want to lose it. So my first message is, don't hem it in, which tends to be a bit of an American expression, but basically it means let's not restrict it. Let's keep it open and let's not over-structure it. Message 2, communicating through messaging, through measurement. What gets measured gets done. And this is for sure true. And all the work of the IOM, and many of you in terms of what we just heard about with the European health literacy study, has provided data and a scientific basis to advocate for attention to this issue. Vital, very important. But what I think is that we need to start looking at ways that we can give people tools to hold systems accountable, to make sure that their systems are more health literacy friendly. And that's why we've been putting a lot of attention into developing what we consider as some simple outcome-focused tools, scorecards, which could be widely available and can be implemented and embrace notions around citizen science and can have both an individual and a system focus. We look at the WHO best buys. And the best buys basically are talking about interventions that people can engage in that have been shown to be very effective, both cost-effective and also save lives. So based on those well-documented, evidence-based best buys, we create a scorecard. And we've been talking with the International Alliance of Patient Organizations, with the WHO Healthy Cities Movement, about instituting some kind of systems-level scorecard, so that you as an individual, we give you this scorecard, we say, okay, is your institution, is your community, is your nation really providing you with the kinds of policies and implementing those policies that are known to make healthier choices easier? So we're also looking looking at some individual scorecards, and Scott earlier talked about some of those, where individuals can look at some of their own metrics and as outcomes of their health literacy, and then start raising awareness and having some notion about things that they can do about those. And there's quite a lot of benefits to some of those individual scorecards. A single number means easy for people to keep track of their health, establishes simple goal ranges, includes a range of medical and health indicators and behaviors that helps people create a mental model of how to make lifestyle choices and NCPs are connected, etc. Number 3, health information marketplaces. We're not operating in a green field here, ladies and gentlemen, okay? We're talking about health literacy, but there are a lot of people out there that are trying to promote health illiteracy, or health literacy as we talk about. And what are we talking about? We're talking about hazard merchant domination of health information marketplaces. Who are the hazard merchants? There's the arms industry, the tobacco industry, drinks industry, fast food industry, that are putting major investments into ensuring that people are choosing their products as opposed to health. They're choosing risk as opposed to, and hazard as opposed to health. So when we can't just focus on the health literacy part, we also need to be thinking about how we can counter those. And certainly, she who controls the frame controls the debate. And framing is a very key issue. So the tobacco industry was very successful in framing issues around rights, the right to smoke. And anyone who was talking about their not right to smoke was considered health fascist. Right? So when we were working on the Framework Convention on Tobacco Control, we needed to reframe the notion about tobacco as a rights issue, but make it more of a public health issue. So we had a motto was, tobacco kills, don't be duped, don't be fooled by an industry that's trying to manipulate you. Same is true in terms of immunization issues, where we're talking about the immunization skeptics, keeping the debate, framing the issue around safety. Safety is important, but the issue of immunization is not so much about safety, it's about protection. It's about protection about real threats and diseases and stuff. We need to reframe that around protection. So we can learn a lot from the hazard merchants in terms of their skills of how they're able to manipulate people, but we do it in a more positive way. So, we can reframe stuff, and there's some really exciting and interesting stuff about reframing messages and making it, that message better. Campaigns that people are running in many countries to raise awareness about issues. Education campaigns by different groups, patient groups, information to Head Start programs, NGOs, about how to get people, raise people's health literacy, and actually learning a lot from the hazard merchants, and then integrating those communications into comprehensive programs. Finally, I'd like to focus on the fact that, and we've heard lots of examples of this throughout the day, that there's a mass communications revolution going on. We're all aware of that. And we need to be in the center of that or be partaking about that. I was very pleased to get an email from Renee Kidwood earlier this week saying that she's now opened a Twitter and a Facebook account. And I'm an active follower of yours already. And I gave you a thumbs up on your Facebook page. Right? But the reality is that we need to be engaging in all those various, new social media tools. It's 3/4 of the global population now has mobile phones. But we also see that there's a media consolidation, both globally and nationally, and getting independent information is harder in many respects. So we have challenges and opportunities. But global reach, internet. We have new platforms galore. This is a Patients Like Me platform, where people can communicate with other people with similar kinds of health conditions and diseases, and they can help each other, inform each other, raise each other's health literacy about what are some of the options people have. What I want to say as a fourth message is, let's be a universal connector. Let us use our capacities and knowledge about these various interventions and our various experience, that we start linking people around the notion, and use health literacy as a platform to develop this global health community, as Joe Ivy Buford opened this meeting with. And indeed, I think health literacy can be that linker, and all of us as a community can help make a better world with that. Thank you very much.